recording.
Yeah. There we go.
All right. So doctor, a lot of people are saying like, it's time we end masks mandate, we end lockdowns, vaccine passports. I know that's a pretty big question to you, but I trust your opinion. What do you think? What do you think we should do going forward?
So I always do. I like to take that step back and say, what is the public health objective of what we're trying to do? So, take away the emotion, take away the politics, take away the polarization, because, we're very, very polarized at the moment as a society, and ask what were we trying to achieve, or what are we trying to achieve, and where are we going? So when I think of, for example, the easy one to answer is the vaccines, this is really talking about what we know now. It's not to look back on what decisions may have happened in the past. But what we have seen very clearly is the vaccines do an excellent job at reducing the risk of severe disease, hospitalization, and death, and that is maintained. What's also become very clear is that vaccines don't stop transmission. With Delta, there may have been some reduction, though even then we knew it wasn't complete. With Omicron, it's pretty obvious that we're not stopping transmission. And really all you have to do is look around the numbers in Ontario, look around the numbers around the world. But that doesn't mean it's a failure of the vaccines. It simply means we have to acknowledge that this is a very powerful tool. And now let's target and hone how we're using that tool, which is to protect our most vulnerable. Now, when we think about the mandates and the people who are sort of pro or con mandate, the question is, what's the reason for having a mandate? And we can encourage and ask vulnerable people to be vaccinated because that is a dramatically useful thing to do to keep you out of hospital. But if the reason for the mandate is that we thought we were going to stop transmission, well, then clearly the mandates, it's time to revisit the mandate. But also you need an endpoint. What is the endpoint? I mean, we've got a very highly vaccinated population. Our seniors and our people with risk factors, who are the people who are most likely to land in hospital, have very high rates of vaccination. And so at what point do we carry on? These are seasonal viruses. We've already seen the numbers going down. This is happening everywhere in the entire world. So I think it's a very fair question for people to say, okay, come on, like what are we doing now? And so I'm one of the people who obviously is extremely in favor of our vulnerable adults and any vulnerable person in our population being vaccinated. But I too am I think we need to have a very realistic, non-emotional, non-political conversation about what on earth the point of the mandates is. It's obvious we don't need them anymore at the airport. I mean, many of us have been talking about this for a while, that the travel mandates make no sense whatsoever. We can now, and we're talking about today, we're not talking about sort of a year or 2 years ago. It's very clear that mandates do absolutely nothing to stop transmission in different settings, because if they did, we wouldn't be all shut down again. And so it's not an unreasonable question, I think, for people to ask. That's the vaccine one.
Right. And then masks, how are we doing there?
So masks, again, are one of those interesting questions. So again, what is the objective of the masks? And it's hard because people become very emotionally attached to either mask or no mask. And again, it's so polarized. And so to try to have a conversation about what is the purpose of doing this 2 years in, we have a lot of information now on whether or not masks work and in what situations they work. And it's pretty clear, for example, and I don't think anybody's going to dispute this, that cloth masks or face coverings of that sort do very, very little. And we've got very good studies from Denmark, and probably more important is a very, very good study of Bangladesh that showed even with the surgical masks, the decrease in transmission was minor, maybe not even clinically significant, and only seen in people over the age of 50. So no difference whatsoever in transmission or in getting COVID in anybody under the age of 50. We have innumerable school studies now that have shown no benefit to our students masking. And so again, an intervention that may have been done out of the abundance of precaution at the beginning, if we're at a stage where we really have a very vaccinated population, We have a lot more information. We can look at a lot of jurisdictions from overseas, a great many jurisdictions from overseas, particularly when we look at the impact on younger people and in schools, to demonstrate very clearly that we simply don't need to be doing it anymore. And so, yes, again, maybe the time for a mandate is long gone. Remembering, this doesn't stop an individual person from making your own risk assessment. So some people feel more vulnerable. They may want to avoid crowded conditions for a while. People may want to wear a KN95 or N95 for their own personal protection. But remembering, people who are vaccinated are protected. And if you're choosing to wear an N95 or KN95, that's for the individual personal protection. It doesn't matter what the people around you are wearing. And so transitioning to people being allowed to make their own individual risk assessments is maybe the right thing to be doing, as is happening in a great many countries around us. Well, not really around us, in Europe.
Around the world, I guess. Yeah.
Yeah, around the world.
And then, yeah, how are they doing? I'm just curious. Like UK, I think lifted a bunch of stuff like a week ago or 2 weeks ago, and like you
Yeah, the
said
numbers
last
are coming
time,
down.
like there's a wave. You go through the wave,
Yeah,
whether you do stuff or not.
it's exactly the same. Honestly, you can look at the Financial Times actually has really good data analysis if anybody's interested in looking it up. And there's also a site called Our World Data, which are kind of, they give you lots of chances to compare jurisdictions. You can put in individual countries and look at how the curves have done. So you can look at, for example, a country like Sweden or any of the Scandinavian countries where, for example, for children, they've never ever had the mask, and with the exception of maybe a few weeks in spring for some of them, have never had school closures. You can compare that to the countries with the strictest mandates and jurisdictions. You can look at Germany, which had mandated medical masks, including KN95s in some jurisdictions, and compare it to countries that didn't. And honestly, the curve of the pandemic is the same. And so really we're dealing with a virus, and it's nobody's fault. It's not the fault of children. It's not the fault of people who haven't been vaccinated. It's not the fault of people who have been vaccinated. It's a virus. We've done a remarkably good job protecting the most vulnerable members of our society. And so asking that question about, is it time to move forward? I think is yes, it is time. And as is being advocated by quite a few of our medical officers of health, that what we are dealing with now in terms of severity of disease is really very similar to any virus we deal with every season. And certainly I know Dr. Moore has said that, Dr. Bonnie Henry has said that, Dr. Tam is saying it's time to move on. And so this isn't it's not political. It's simply, this is where we're at now. Things are different. And it's going to be challenging. There are people who want everything done all at once, and there are people who are still very, very, very scared. And it's going to be, I think we have to be kind to each other. We have to acknowledge that we're all at different comfort levels, but we really do need to let people make their own individual risk assessment now. And I am one of the many physicians now who thinks that the role for mandates at this point is very questionable.
Good point. I think a lot of people at this point probably agree.
Yeah.
That's their decision.
But it's so important that when you say this today, this has nothing to do with decisions that were made a year ago or last year, because it's not helpful and it's not productive to start pointing fingers and trying to blame each other. It's not a one-upmanship game. It's not about anybody being at fault. It's about, okay, this is where we're at. This is where we have in terms of risk. We know now that the vaccines work to protect a person. Unfortunately, it's disappointing, but they don't work to stop transmission. So it's disappointing. It doesn't take away from the immense value of the vaccines, but it does bring into question a lot exactly what the objective or the purpose of mandates are. There's another thing about mandates that makes me very uncomfortable is there are public health recommendations. There's certain high-risk settings where we have to be a lot more cautious. But we're in a weird situation where a lot of individual organizations are suddenly making their own decisions and suddenly thinking it's okay to demand medical information. And I really feel that we're getting a little bit out of control in terms of understanding or having rational conversations about what the point is. And I guess I'm thinking about some of the restrictions on children. For example, really no child or youth should be banned or restricted from any activity based on whether or not that child's parents decided to opt for the vaccine for the child. And we really need to sort of, again, take that step back and think, okay, what was our public health objective? So we wanted the individual protection, mission accomplished. We wanted to protect our hospital capacity system. The way to do that is to vaccinate as many of our vulnerable people as possible. So the people who are going to land in hospital in the first place needed to be vaccinated. And I think we're as good as we're going to get there. So personal protection, very much so. Hospital capacity protection, we're getting, in the end, it's never going to be zero people admitted to hospital. And this is the other reason we have to talk about objectives, because there's some people who seem to think that one case is too many. But this is a virus. There are always going to be some people who are vulnerable. But the third objective of reduced community transmission, that's not happening because of the vaccines. And so where are we headed? Well, if you look at it just by severity of disease now. So again, look at today what we've got. Impact on children, impact on youth and younger adults, impact on seniors, were really very similar to most other viruses we deal with. So it doesn't mean Omicron's disappeared or COVID's disappeared. It doesn't mean that the last 2 years haven't happened. It means that we're in a very different position. It's time, really, it is time to stop focusing so exclusively on COVID. I know you've heard me say this many times before.
Yeah, and there, like you said before,
damage.
There's many things to health besides COVID, right?
Yeah,
100%. I'm glad kids are in school
and I
seem
keep
to be
saying
living
that
more normally.
Yeah, I keep saying that it's not COVID versus nothing,
Mm-hmm.
and so because it's really the immense public threat from COVID is really not there anymore in terms of we're not going to have mass casualties. And as it turns out, fortunately, we never really did. And again, in no way to minimize the impact to individuals of what's happened over the past 2 years. But I don't know if you saw the data from British Columbia, for example. They looked at all-cause mortality from March of 2020 to October of 2021. It's the BC, British Columbia CDC data. COVID, I think if you look at it, was number 8 cause of death. But more important is that, and the average age of death of COVID actually might have been number 5. Number 5th cause of death during that period of time. Number 8 in terms of years of sort of quality years of life lost. But anyway, more important is if you look at the average age of death from COVID, it was 82. But then look at the second most common cause of death in British Columbia is drug overdoses. And the average age of death was 44. So in that period of the pandemic, far more people died of drug overdoses and at a much younger age than of COVID. And again, it's not to minimize COVID, but if we don't start paying attention to the things that are driving the drug overdoses, and we have way more people who've died of that at much younger ages. And so this is the balance we have to find. And so when we start to say it's time to move on, is to acknowledge that our kids are hurting. We've destroyed businesses, we've shattered dreams, we've harmed our children, we have huge mental health crises across every age group. And so saying it's time to move on is not to deny COVID, is saying, we're at a stage where we can balance this. And remember that public health encompasses way more than COVID. So
good stuff. I appreciate it. That's all.
Yeah.
Sorry, Lisa.
We'll see. What was that?
Oh,
not for you.
No, we work in a room and we voice sometimes, and it's all good.
Oh yeah, that would be like us. Yeah.
Yeah.
Yeah. It's and you start with the protests. Honestly, I don't know what drove the protests. I try to stay out of politics. I think health and commenting on this should be apolitical, but I keep looking at the news and thinking it's clearly tapped into, there are clearly a great many people across our country that are saying, can we please revisit where we're at? And this is not, again, a negative. It shouldn't be a criticism of the last 2 years, but it should be very clearly that time is now to let people make their own risk assessments and make their own decisions.
Good stuff. Well, I thank you for your time, Doctor.
My pleasure.
Thank you.
Enjoy the rest of your day.
Thank you very much. Enjoy your Sunday.
Thanks.
Talk to you
Take
next time.
care. Yeah.
Take care.
Yeah.
Bye-bye.
Bye.